Currently, there's a national shortage of child and adolescent psychiatrists, and in most communities, there's a 6 to 9 month wait. Our goal is to make things better for the children here in Tulare County and decrease that wait time to 1 to 2 weeks in order to see a child psychiatrist. Currently, children who need care are typically brought to the emergency room when they're in crisis. The ER can be a relatively chaotic place and relatively scary, especially for younger children. The Crisis Stabilization Unit will be just the beginning of changing child mental health here in Tulare County. The Crisis Stabilization Unit will provide the children with a safe place where they can come and seek these services. This could be children coming in on their own, being brought in by their parents, or sometimes being brought in by either field crisis officers or even police officers. This has been a collaboration between Tulare County Mental Health and Kaweah Health. Because Tulare County Mental Health is one of the largest providers of mental health services and has access to a lot of resources, and Kaweah Health has access to a lot more expertise in the field of child and adolescent psychiatry. We bring in well-trained physicians in the field of child psychiatry, but we also bring to the table the Child and Adolescent Fellowship Training Program, where we can continue to train the next generation of child psychiatrists to take ethical, compassionate, and competent care of children. We take children up to the age of 18 at the Crisis Stabilization Unit. Once they come to the facility, they can stay there for up to 24 hours at a time. So the goal is to evaluate the child and send them home or find them placement at some higher level of care within the 24 hours. We're currently looking for a permanent home. That has yet to be decided, but we are looking to get these services up and running as soon as possible by having a temporary location which will be housed right across the street from the emergency room on Noble. We have enough space for about 8 children at any given time. It is a 24-hour facility staffed by a medical doctor, by nurses, LVNs, and licensed psych techs. There will also be a team of social workers, both through Kaweah Health and through Tulare County, who are able to communicate to patients in their native language, including Spanish. Everybody will have equal access to our services, whether or not you're insured, you have Medi-Cal, or are uninsured or indigent. And eventually, once we move to our permanent location, the Crisis Stabilization Unit will be part of a comprehensive child and adolescent behavioral health campus that will continue to be a joint project through Kaweah Health and Tulare County.